Let's talk about a hot topic in hyperbaric medicine. Does hyperbaric oxygen therapy help people experiencing post-COVID-19 symptoms or long COVID? Long COVID lingers and can last weeks, months, or even years after a COVID-19 diagnosis. It can result in disability in some patients. Hi, I'm Reagan Holliday, president of HyOx Medical Treatment Center, located in Atlanta, Georgia. HyOx specializes in undersea and hyperbaric medicine. Since we opened in 1999, our double board certified physicians have provided hyperbaric oxygen therapy to countless patients with all sorts of medical issues. We know hyperbaric oxygen therapy could help a lot of people with long COVID's long-term effects. An interesting survey conducted in June 2022 by the U.S. Census Bureau and analyzed by the CDC reported the prevalence of the disease. From the more than 40% of adults surveyed who had COVID-19 in the past, nearly 1 in 5 of those reported still having symptoms of long COVID. Long COVID symptoms are defined by the CDC as those lasting 3 weeks or more after first contracting the COVID-19 virus. They range from general fatigue and neurological issues to symptoms affecting the heart, respiratory, and digestive systems. Stick with me and we'll review those symptoms later. The data reveals some fascinating statistics. Nearly 3 times as many adults between the ages of 50 and 59 have long COVID than those age 80 and older. And more women than men experience it. Multiple hyperbaric medicine clinical trials and studies are happening, and anecdotally, the results are promising for those suffering from long COVID symptoms. Despite reliable results with clearing the brain fog and many other symptoms long COVID patients feel, hyperbaric oxygen for the treatment of long COVID is not currently an approved condition by the FDA or the Undersea and Hyperbaric Medical Society. As of this video's post date, hyperbaric oxygen therapy for the treatment of long COVID lacks the clinical research and peer-reviewed studies needed to be deemed an approved indication. HyOx is monitoring current long COVID research and is assessing its hyperbaric oxygen patients for long COVID symptoms. We strongly believe hyperbaric oxygen therapy can help and are hopeful it will garner the attention and research needed to become an evidence-based and insurance-covered condition. Anecdotally, HyOx helped one of its team members after she contracted COVID and experienced its long-term effects.
Hi, my name is Babette Lynn, and I am the billing manager here at HyOx Medical Treatment Center. In August of 2022, I was stricken with COVID. And with COVID, I had the symptoms of brain fog. I was also had vertigo, very bad. And because I do work here at HyOx, Dr. King graciously enough allowed me to do the treatments because there's been several studies that the hyperbaric chamber does help with the long COVID symptoms. Did the treatment and it was wonderful. I felt better, the brain fog went away, and I'm back to normal. With the treatments and the studies that are going on, I truly and highly recommend hyperbarics for long COVID patients.
Here are the long COVID symptoms as reported by the CDC. Tiredness or fatigue that interferes with daily life, symptoms that get worse after physical or mental effort, also known as post-exertion malaise, fever, difficulty breathing or shortness of breath, cough, chest pain, fast beating or pounding heart, also known as heart palpitations, difficulty thinking or concentrating, sometimes referred to as brain fog, headache, sleep problems, dizziness when you stand up, lightheadedness, pins and needles feelings, change in smell or taste, depression or anxiety. Other symptoms include joint or muscle pain, rash, and changes in menstrual cycle. What's your experience with long COVID? What's helped alleviate your symptoms? Let us know in the comments below.